Dear friends, you might have watched many children walking with in-towing, right? Normally, whenever a person walks, whenever a baby walks, it will keep around 10 to 20 degrees foot outside like this, and we will walk, right? Normal adults will walk like this. We will never walk like this, right? So this is called as in-towing gait. Okay. So some of the children, when they are born, no, they will walk like this, right? There are so many reasons why they will walk it, and briefly I'll explain you. Well, one of the conditions is that what is called as forefoot adductors. Okay, in the foot itself, the say you can say mid off of the front of the what I can say the off of the foot, no, in the front would have got inside. We call it forefoot adductors. So that great toe comes inside, right? So they will walk like that's one of the conditions. And if that is the condition, you better to consult a doctor immediately. If you watch any deformity in the foot, suppose if the foot is not looking normal, right? If it is looking curved or something like that. And there's one more condition called a CTV, congenital talipal equinovarus, and this is altogether different condition. And such cases I have treated more than 300 and 350 cases without surgery. All of them are doing very great. I have got one more video of the CTV itself. Please see it if it is needed for you, for your knowledge sake, or for referring any other patients. That's the one thing. This is different. This is only just forefoot adductors. If you find any of such deformities in the very newborn, maybe 1 month, 2 months, 3 months, please show it to the doctor at the earliest, right? Especially the orthopedic surgeon. Once you show them, they will see it, they will evaluate if it is needed. Sometimes we may put the cast also, serial castings will put, your plasters will put, and will correct it. Sometimes we may advise some strapping or some kind of splints or something like that will help to keep it in a normal position. That's the one thing, right? Second cause could be like we call as tibial intorsion. Tibial intorsion is a condition wherein the leg bone, no, the bone which is called as tibia, we call as tibial torsion. It's a tibial torsion where the leg bone, the bone which is there between your knee joint and the ankle joint is called as tibia, and there will be tibial intorsion. So that's one of the conditions where you will have a in-towing gait. And such cases, depending on the severity, most of them will improve, maybe by 4 years, 6 years, 8 years, depending on the intensity. Most of them will spontaneously get to recover, right? And there is one more condition in the thigh, we call as the femoral neck shaft angle. There is excessive anteversion of the femur. So that's a condition where once again patient will walk in a tiptoeing, in-towing gait. So if any of such things you please notice, please don't diagnose yourself and start the treatment. Go to a nearby orthopedic surgeon, show to him, let him evaluate, let him find out where is the cause, what is the problem. Then there he will advise you accordingly, right? That's very important, very crucial. Don't make any self-diagnosis. Don't start any self-treatment as such. Okay, if you follow this, that should be very easy to get the treatment. That's the one thing. Second thing, you should have noticed that such children, no, whenever they're sitting on the ground, they sit in a W shape. They will put their legs outside and sit like this. That's called W type of sitting. Okay, so you should always tell them to not to sit like that. Especially children who are going to LKG, UKG or Anganwadi, and you should go to their teaching staff or Aya who is taking care of, or grandfather, parents who are taking care of such children. No, they should be advised that those children should be discouraged sitting like that. They should either sit in a cross-leg position, or they should sit with their legs stretched like this. So these are the position which they have to maintain. Very, very important. If they maintain like that, the chances of recovery will be very fast. As the one thing. Second thing, there are some exercises, right? I will put small videos so you can go through, or you can Google it also. There's what is called big bear walking like a big bear. No, if there's a one exercise. Second is sumo frog jumping. The frog race which we might have enjoyed doing our childhood, I think that's called a sumo frog jumping. That they should practice, children with in-towing. Next, what's called as cheeky crab walking. So walking like a crab, that will also encourage the foot to put in outward direction and to out-towing and walking. Only one more word called as penguin walk. So it's very easy for children to remember, like very easy. One more is penguin walk. You might have seen how the penguins walk, right? Penguin walks like this, right? With the foot going towards the wall like this. So here is in-towing. You should ask the child to walk with the toes putting outside like this. If they walk like this, that will also help in stretching of the muscles, and that also hasten the recovery, right? So it's very convenient for the children. You can ask them to walk like a bear, jump like a frog, then walk like a crab, and also walk like a penguin. So they definitely enjoy this kind of walkings. Let you encourage those people, children, to do this kind of walking, so that will increase the phase in the recovery time. Okay, these are the simple things, nothing to worry. Most of the times that will recover spontaneously, but please show to a consult orthopedic surgeon. Let him evaluate and guide you accordingly, right? So I am Dr. Muralidhara, orthopedic surgeon, professor practicing at Tumkur. I have done so many such videos. Please do subscribe my videos. I have done more than 280 such videos. Please do subscribe, and please do forward this video to any of children who are in your vicinity or relatives, friends who is walking like this, so that they will also see this video. They will get the awareness and they will tackle the child at the very conveniently, right? All the best.